It's 4:31. I will now call the meeting of the Human Services Committee to action. And I'll start with the affidavit of posting. This agenda was posted in the office of the county clerk on the 20th day of May, 2021. Notice was sent to the West Bend Daily News, Express News, WIBD, WMBZ Radio, WTCAM Radio, My Community Now, Hartford Times Press, Kewaskum Statesman, and Milwaukee Journal Sentinel. And with that, would you please stand for the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, we do have a quorum. Peter has been excused. And the first item on our agenda is the consent agenda, so I'd entertain a motion to approve.
Motion to approve. I'll second it.
All right, any comments or anything on the consent agenda? There being none, all those in favor, please signify by saying aye. Aye. Opposed, that motion carries. We have only discussion items today, and the first one is ADRC presentation. Tammy, you're up.
All right, good afternoon, everybody. Good afternoon, Tammy. Okay.
Nice to see your smiling face.
Julie told me I had about 75 to 90 minutes, so I'll keep it to 75. Teasing, I'm teasing. All right. Takara, is that as good as it's gonna get, or like if I just went side by side? There we go. Okay. All right. Well, we have a already prepared presentation at the ADRC that we get out to community members, other departments, but I really boiled this down. So I'm just trying to stick to the core services. And this month is ADRC month. I know there's a lot of celebrations. There's a day and a month for everything. But I thought this would be a good opportunity to let everybody know a little bit more about the ADRC. So the mission of the Aging and Disability Resource Center is to empower and assist individuals, seniors, adults with disabilities, and their families by providing services which help them make informed choices, maintain independence, and remain safely in their homes. I won't be reading the rest of the PowerPoint. I'll kind of highlight the important parts of the slide, but I did think that was an important one. So we want to be a one-stop shop when somebody is coming in for our services. We really want to be able to meet all of their needs. Sometimes that's just in one appointment. Sometimes that's in several appointments with one of the staff at the ADRC. And all of our services are free. There is no charge for any of the services that we provide. These are the core services, what we're mandated to provide through our state contract. So we have information and assistance, which is connecting people with resources throughout the county for a variety of things. I'll get into some more detail about some of these other ones. Long-term care options counseling, that's really more of a process in which we are meeting with the person, laying out the options and helping them make an informed decision. We are the access point for any long-term care funded programs. So some of the words you might recognize would be family care, IRIS, community care, those sort of things. We are the place that you have to come to get those benefits. Benefits counseling, so helping adults with disabilities and then those 60 and over with insurance needs, Medicare, Medicaid, that sort of thing. We have the senior dining program for the county. Right now we're just doing home delivered meals out of 7 sites throughout the county. We deliver about 250 to 300 meals per day. And we are opening up our first congregate site again on June 2nd. So we're excited about that. We run a, I'm sorry.
Are you doing okay with drivers?
Yes.
Volunteers?
Yeah, when COVID first hit, we lost a lot of drivers, but we partnered with churches and other agencies, and very rarely, thankfully, we had to either use staff within our department or within other county departments. But it was a smooth transition. Having Samaritan as our caterer was huge because there were counties that lost their, their caterers had closed down. So it was difficult, but we made it through that transition. We have a variety of health and wellness programs. I'll get to those in a little bit more detail. And then our dementia and caregiver support. So information and assistance, basically when you call the ADRC, most likely you're going to get to one of our information and assistance specialists. And they are going to talk through a whole bunch of stuff with you. They're doing motivational interviewing, kind of finding out what the need is, and then going from there to gear the services. So financial needs, transportation, mental health services, all the things listed on that slide. Other things that we assist with, long-term care living arrangements. I'd say that's probably one of the things we get called about the most. My parents can't live at home anymore. They need to move to an assisted living, nursing home, that sort of thing. Short-term service coordination. So at the ADRC, the staff are not caseworkers. We don't follow a person long-term. Our services are really short-term, and then get them the help they need or enroll them in a program where they then would have a caseworker. Transitioning for a youth with a disability into the adult service world. So we work closely with our CLTS program and the Human Services Department for that. And then I had already talked about the Medicaid long-term care funding, those things such as family care and IRIS.
And CLTS stands for what?
Oh, I'm sorry, Children's Long-Term Support.
Okay, thank
So
you.
the staff in Human Services that works with children with disabilities. Options counseling, all of our information and assistance staff have recently been certified as options counselors. That is a process and certification through the state. And in a future meeting, I'll be bringing you some really exciting information I found out today about return on investment. So what that is doing for people and for hospital readmissions. I know Pam, you'll be interested in this, for emergency department visits, and how coming to an ADRC can really help utilize those dollars to keep people as independent as long as possible. So when we are doing options counseling, we're meeting with the person, but we're not just giving them the resources, we're also giving them an action plan. We're helping to whatever level they need, connecting them with those services, and then doing follow-up. And that process we have found in the short amount of time that we have really been doing those things as we are supposed to has created some great outcomes for the consumers that we work with. These are a few things people call about, things that we can help with. Like I said, a lot of times it's people that aren't able to live at home anymore, but we help identify resources to keep people independent as long as possible. Some of the resources, I don't know if you're familiar with our yellow book, people call it. It's our resource directory. So just a wide variety of services that are in Washington County. We put that all together in a book, but if you call the ADRC, they can help you with some of the things or all of the things that are listed on this slide here. We have a dementia caregiver support specialist, Tammy Dickman. So she will work with people with memory impairments, Alzheimer's, dementia. She'll help do a memory screen to help kind of identify where somebody might be at, assisting people with planning for the future, and keeping people in their homes as long as possible. I keep saying that, but that's always the goal, to keep people independent as long as possible. And then some of the classes that Tammy and some of the other staff provide are a powerful tools for caregivers and a savvy caregiver training. So these are evidence-based classes that provide that support for the caregiver. The powerful tools for caregivers can be for caregivers of any adults. And then the savvy caregiver class is geared for people caring with someone with dementia. So this is something I'm excited about as well. We're starting up our classes in person again. Yes.
So who is able to attend these classes? Any Washington County resident?
Yes. Mhm.
Thank you.
Yep. And these classes, particularly the powerful tools class, is offered in just about every county.
Okay, thank you.
Mhm. We have the Alzheimer's and the National Family Caregiver Support Program. The best way to describe these is we get 2 different pots of money in which we pay for a caregiver to go into somebody's home so that the caregiver can have a break. So it lists here to be eligible. These are adult family members caring for somebody with Alzheimer's disease or caring for somebody that's 60 and older. And then we also are able to provide support to grandparents or relatives that are caring for children that are not theirs under the age of 18. So again, providing respite, we've provided funding for those kids to go to day camps or certain summer programs so that that caregiver can have a break from being a caregiver because it's a burden to care for somebody 24 hours a day. Now, these are limited pots of money, limited hours or financial cap on these. So if you know somebody, they can call us and kind of explain all of that, but this is not something where we're providing, 8 hours of care every day. It's a really limited short time program. We mostly spend our money on respite care, bringing somebody into the home, but I did mention some of those other things for the kids that we're providing. And then we can help with things. We have done some ramps for people to be able to get in their home, walkers, assistive devices, safety and security type things, personal emergency buttons. So there are other things that can be spent on, but the majority of it is for those respite care services. We have 2 benefits specialists and then 2 assistant benefit specialist staff within our office. So our disability benefits specialist, Hollis, works with people 18 to 59. I would say the majority of her role is helping people that have not been approved for disability. There's a high percentage, I don't know the number off the top of my head. I think it's above 75% of people the first time they apply do not get accepted. And that appeal process is very grueling. But she is able to help with a variety of other benefits as you can see here. So Medicare, Medicaid, health insurance, food share, energy assistance, that sort of thing. And then an elder benefit specialist. So she's working with our 60 plus population, getting people connected with benefits or all of those benefit issues. And just today, I got one of those great phone calls where a lady said she suffers from a panic disorder. She had a giant stack of papers and our elder benefit specialist spent 2 hours with her helping her understand those and then getting some of her benefits sorted out so that she was able to pay the bills that she had coming in and find the best benefits available to her for future needs. So those are always nice phone calls to get. Our wellness and prevention programs, I talked about the senior dining program. Most of our sites provide a hot lunch meal 5 days a week. Those are delivered by solely by volunteers throughout the county. And we also right now have a waiver to be able to provide the carryout meals because we were not providing congregate meals. And meals are provided on a donation basis. So nobody is denied a meal because of their ability to pay. And then some of the other programs we provide, and once again, excited about starting those up soon. These are classes for people 60 and over, health and wellness classes, evidence-based classes, so strong people. It's a strength training class. The new one that I didn't get certified, 2 staff got certified in, is living well with chronic pain. A stepping on class, which has to do with balance, falls prevention, and then healthy living with diabetes. And we provide these either at the Public Agency Center at a variety of community centers or senior centers throughout the county. And then we also have the Farmers Market Voucher Program. So seniors are able to get vouchers to buy fresh produce at the farmers markets in the county. I pretty much said all this, except for that we're super friendly and welcoming. So you can call us, and then you can also meet Joyce, who's just wonderful. She is very friendly and welcoming. Our services are provided at no cost. We do have a waiver right now that we do not have to provide face-to-face services for some of the things that we typically do have to have a face-to-face visit, but we are accepting walk-ins or meeting with people at their homes or in our office if we feel that the services would suffer without our face-to-face contact. But everything we do, we can do via phone or via email. And we have had no concerns with the services that we've been providing over the course of the last 15 months or so. So that is all about the ADRC in a very brief presentation. We have our office here in West Bend at the Public Agency Center, obviously. And then we also host hours at the United Way Resource Center in Hartford. We staff that office 3 days a week. They will be opening up again June 1st. So we intend to be out there to serve the people on that side of the county as well. Does anybody have any questions?
Thank you, Tammy. That was wonderful. ADRC provides such great services.
Thank you.
How does someone in the general public find out about ADRC?
I think the best way would be to call us. Joyce is great at just kind of figuring out what a person is calling about and getting you to the right person. If not, like I had said, we would send you to an information and assistance specialist first.
But how do they even know you exist?
Well, we are out and about in the public normally, pre-COVID and starting up again, doing a variety of events and marketing. And anytime we have a special event going on or holding a class, we're really targeting where we're going to get that information out to. So we have some really close relationships with the senior centers, the community centers. We have some contracted relationships and the relationships otherwise with home care providers, assisted livings, nursing homes, hospital discharge planners, the other departments in the county. And we do our best to be providing a presentation like this, but much longer, in places all around the county. And there's several staff within my department that really like to do that. So we've done them at hearing centers. I mean, you can kind of think of the typical things I was mentioning, but we try to think outside the box too. Where can we reach people?
Do you know, do doctors' offices offer this information?
They usually don't entertain our blabbing, but we do get them information, and we have our yellow book, our resource directory. I think there's some up on the second floor in the resource rack up there. So often we will contact those places to just drop off an entire case and then they hand it out. Okay. But it's not easy to get into a doctor and kind of give them our spiel, but our information is out and about throughout the entire county.
Okay. All right, great. Any other questions?
Yeah.
Go ahead.
I'll go first, I guess. Yeah, and I think it's incumbent upon us to refer people that we come into contact with. I've done a number of referrals.
Thank you.
And it's amazing how comprehensive your coverage is for people. Medicaid, the Badger Care Plus, Title 19, do we have anybody falling through the cracks? Are we serving all the people that are in your
That are
um,
coming through our
yeah,
doors.
that are,
So
are there any, I mean, are there any cracks where people come in and you can't help them?
Sure. We track in the database in which we are tracking all of our contacts, unmet needs. One of the ones that I can think of that's coming to mind is transportation for people with disabilities. There's a lot of transportation options for people that are 60 and older. But then we joined into the Washington County Coordinated, one of those long acronyms, a
right.
Washington County group that is not only transportation providers, but the mobility manager who works out of Interfaith, one of the staff from my office, and several other people to try and solve that unmet need. So that's also a requirement of our contract, that we are reviewing those unmet needs and then advocating for those populations or those needs to find a way to meet them.
Cool. That's great to hear. Thank you.
Yeah, you're welcome.
You're okay.
Okay. Your presentation that you shared with us, is that okay if I share it with some of my constituents?
Absolutely. Yeah.
Would this be the appropriate one or versus the longer one?
This
or-
one is probably more appropriate if they are
Okay.
interested in further information or have a group that they would like this presentation in person or a larger presentation. We can certainly gear it towards that group of people.
Okay, thank
Yeah.
you. And if somebody would like to donate to this program, to ADRC, how would they go about that?
They call my personal cell. No, I'm just teasing.
Okay.
No, they could contact the office and then we take the donations, receipt them through the treasurer's office here, and they go into the parts of our budget that are covered or not covered by our funding sources.
Okay, very good, thank you.
Yes, you're welcome.
Because it is ADRC month.
It is ADRC month, yes.
So where does the most of the funding come from for ADRC?
Federal or state grants that when I say grant, I always think of a grant you write for. These are really more pass-through grants. So the nutrition program is federal money that comes through the state agency and then down to the ADRCs to provide those meal programs. And right now, several extra funding sources via the CARES Act or all other sorts of acronyms for COVID-related things. So.
Any other questions? Nope. Okay. And there is an ADRC in every county in the state?
Every county, yep.
It's just for public information. I want to get out as much as
Yes,
I can.
yep.
Okay. Terrific. Thank you.
Thank you all.
All right. The next item on our agenda is operating while intoxicated, treatment alternatives and diversion program 21, also known as the TAD program. And Julie, are you
I am
addressing
going to
this?
present that, yes. So because we're just doing an internal budget transfer, there's no action needed on this. But we thought it's important for this committee to just know we were making this budget transfer within our budget. And also just to give you a semi-update on where we are with this project. So for those of you who were on the county board in 2018, we maybe just you, Chris and Don. We had a OWI TAD program for many years that was funded by the state of Wisconsin. The state then shifted their focus with that funding to focus on opioids. And so we've been running our opioid TAD program since 2017. Our contracted partner who does this work for us out in the community, Elevate, worked with a professor from UW Washington County, and they were able to do some data analysis and demonstrate the positive outcomes for people who participated in OWI TAD. And so we had conversations at the Human Services Department and with the then county administrator and brought forth to the county board a pilot project to fund OWI TAD, again, because the outcomes for that program were so positive for people who were suffering with addiction. So the original request, general fund transfer, was for $250,000. It was for a 2-year pilot program. We were able to run that program for 2.5 years, and actually also did about 7,000 non-lapse into this year. So I would say probably 2 years and 6.5 months. It funded with the original $250,000. The plan was then to reevaluate to see if that data remained consistent with the program over those 2 years. However, as if you know how data works and getting a good sample size for your analysis, by the time we were trying to make 2021 budget decisions, we didn't have, that was last July, we didn't have enough data to be able to really ascertain that the outcomes were continuing. So in conversation with the county executive, we were going to do a general fund transfer to fund the program for an additional year into 2021. And then make that final decision this year on whether we would put it into our budget long term. So, however, in analyzing our budget and the changes that we have often with the needs of different consumers within the community, we had a couple of high cost placements that we were able to reduce their costs because they went into a lower level of care. And so that that money is sitting in our budget unallocated because the needs of some of our clientele have changed. And so I talked with the budget director about just using that money that was within our budget rather than a general fund transfer. We all decided that was probably the best idea. And so we're just informing you of that today. So if you have any questions, I'm happy to take them.
Is the professor from UW Washington County still collecting the data and analyzing it then?
Yep, and so we're working, and Doug Bry is here, our division manager for behavioral health, and we're working with Elevate right now to finalize that report.
Okay. All right. Any questions from anyone?
Good.
Yeah,
Thanks.
this is a great program that I know all the judges are feel very strongly about, and the data that has come out of offering this, being able to use this program. So I hope we can continue to do that. Thank you.
Thank you.
All right, then the next item is Youth Comprehensive Community Services Presentation. Now, this is a face that I'm not familiar with, so,
I will introduce myself.
okay, good.
I was actually here a couple months ago about
Well,
a new
yes,
position.
but I'm
so,
old and
yeah.
I forget things, so.
There you go.
It's a requirement on the county board sometimes.
Well, I'm Sarah Witty. I am the youth treatment team supervisor over in Human Services, and I've been in this position about 2.5 years now, so new-ish, I guess. And I've actually worked in CCS for many years. When we started a youth CCS program in Washington County, I was one of the original therapists that was contracted through that program. So it's a program that I really care about and have been invested in for quite a while, both as a contracted staff and now as a county employee. So I'm going to kind of walk through what youth CCS is, share a little bit about what our program structure looks like, a little bit about like what our referrals have looked like. Please interrupt me with questions as I'm going through here. And then I also have a little a success story to share to kind of make it a little more real and not just talk about data and numbers. Oops, there we go. So CCS, you might have heard of Comprehensive Community Services in general. It is a statewide program that is available to youth and adults. I'm going to specifically talk about our youth program today, but we do have an adult program as well. The official, mission statement of CCS is that it helps youth to live their best lives by providing support that help address mental health and substance abuse issues. So basically, we are here to offer any kind of support, whatever that looks like, for youth and families who are struggling with any sort of mental health concerns. There's a functional screening tool that the state has developed. So you do have to be eligible for CCS. There is an eligibility component. We recalculate eligibility every year. It is a Medicaid program, so we bill Medicaid for services. So you do have to have a Medicaid source to be in CCS. You can have private insurance and Medicaid as well, as long as there is some Medicaid source. And there is, I don't know if people are familiar with Katie Beckett Medicaid, but Katie Beckett is a form of Medicaid that is available to youth with disabilities, and mental health qualifies as a disability in some cases, that allows you to get a Medicaid source as a child without some of the income requirements that Badger Care has. So if people come into the program and they don't have Medicaid, we will do what we can to help them get a source of Medicaid, whether that's Badger Care, Katie Beckett, whatever that might be, if we feel like they are going to benefit from the program. And CCS is really designed for youth that need a higher level of care. So it's those youth that have tried outpatient counseling or tried school-based counseling, have tried some of those other mental health treatment programs, and it's not working. So they have to have some sort of previous mental health history, some kind of a diagnosis, and some treatment history that demonstrates, they've tried some of these lower levels of care and it's not worked for whatever reason. And then they will usually be eligible for CCS, where they can get that higher level of care and more of those wraparound services. Yes.
Are they referred to you by physicians, or how do they get to you?
So usually our biggest referral source is schools, actually. That's where we get most of our referrals is from various school staff. We also get a lot of referrals from our youth justice program, our CPS staff, our internal county partners. We work with them a lot on cases where they have been involved with the family for whatever reason. We get a lot of referrals from outside providers, so therapists who have worked with a family and are like, hey, this is just not cutting it. They need a little bit more. So primarily those are our biggest referral sources. And there's a little bit more information about referrals here towards the end of this, so talk a little bit more about that. The nice thing about CCS is, it's not just therapy services. We can really offer a lot of different services. And what I am excited about is that we've grown our CCS program quite a bit since we have started it. So we offer a lot more than we initially did, which is awesome. So everybody gets a case manager. That's sort of the universal service that CCS offers, is a service facilitator, we call it, which is a case manager. So someone who's going to really manage those services for that kid and that family and help them get connected to what they need, make sure that things are going well, check in with them, kind of serve as just that general case head. We also offer therapy. We offer some skill development or mentoring. So if there's some specific skills that a youth needs to work on, we have some services for that. Psychoeducation. So if families are struggling with different things and need maybe some parenting assistance or just some general knowledge about how do you handle mental health issues, we can provide some of that. Family therapy, we have an equine therapy provider now, which has been really, really neat to see. That's been a service that has been utilized a ton, and it's been really exciting. We have some health and wellness abilities or services to offer in CCS. This is an area where I'm hoping we are going to grow, as we've worked on a new contract here to be able to offer some of those things like yoga or just helping kids get up and moving around, and maybe healthy eating habits, so it's sort of those just general health and wellness things. School support, a lot of our case managers, will attend IEPs or help if there's anything going on at school. The kid is not attending school, helping them figure out, is there an alternative program that they could access? How do we get them there? How do we help support them in the school setting? And then medication management. We do have a psychiatrist or an APNP now at the county who works with a lot of our youth and is able to help provide that medication support if that is necessary. So our team structure, I kind of want to just give you a rundown of what our youth CCS team looks like, because this is where we differ a little bit from the adult team in some ways. So there's me, the youth treatment team supervisor, and I kind of oversee our CCS program. We have a clinical coordinator, Kelly Bell. So she processes all the referrals. So if a referral comes in for CCS, it goes to Kelly. She goes through it, reaches out to the family. She does that initial screening process. You have to be trained to be a functional screener, so there is some training that goes along with that, and Kelly is our trained screener. And then if they are eligible for services, Kelly helps get that set up. So she gets them connected to a case manager and makes sure that that case gets off the ground and taken care of. Go ahead.
Question.
Yes, ma'am.
Kelly's credentials, is she a social worker? Or?
Yep, she is. Right now she's an APSW. She just submitted all of her stuff to get her license and is waiting patiently to get it back from the state. So yeah, she's finished all her hours and all that good stuff. She was one of our outpatient therapists that we moved over into this position in November. So it's a newer position that we kind of tweaked a little bit to better meet our program needs. So we've been excited to have her. Yeah. Right now we have 6 service facilitators who operate within our UCCS programs. They are all contracted through St. A. So they live at the county, the Human Services building. They have office space there. They're really incorporated into our team, but they aren't county employees. They are St. A employees. And so that's the big difference between us and the adult team. They do have some contracted staff and some internal staff, but all of our case managers are those contracted staff right now. And then we have various other contracted partners that we work with to provide all those services that I talked about. So St. A also provides a lot of those therapy services for us. They're our primary therapy provider. Lad Lake does our mentoring services, that's skill development. Hope Chariot is our equine provider, and they're a newer provider, but they've been really cool to work with. And then Dr. Gary is one of our therapists. He's a psychologist who has an independent practice, and he's done some CCS therapy services for us. So those are our main contracted providers. Like I said, we might be adding some more as we move forward, but those are the main ones that we work with right now to provide all those different services. And then I kind of just wanted to give you a sense of what our program has looked like over the years and how it has grown quite a bit since we started. So you can kind of see, starting in 2016, how many referrals we had, coming into 2021. Obviously in 2020, we took quite a dip with referrals, which we expected with COVID, and that was pretty universal across the state with CCS, mostly because our main referral source is schools, and school was not in session, and so we weren't having access to those kids. But I just talked to our data manager today, and we are on track to have the most admissions and referrals this year than we've ever had. So we definitely are bouncing back, I would say, and back on that upward slant for referrals. And currently we have 73 youth enrolled in services and are working on 20 active referrals right now, which will all are looking like they're going to be eligible and will come into services. So that's awesome. And then I talked a little bit about this already, but primarily where our referral sources, where we get our referrals from, are primarily, like I said, those schools, youth justice, CPS, and outside providers. Any questions so far?
Have you hired enough to meet this need?
We
I know you
have,
recently
yeah.
added FTEs, correct?
What's that?
You recently added positions and changed things, correct?
We added that clinical coordinator position in the fall to kind of just better handle our wait list and our referrals. And then we've added some positions to our children's long-term support program. And right now St. A added some new positions in December and January. So we've been able to accommodate these referrals. And then we do have space for another facilitator if we get to a point where we need one. So we work with St. A on that and kind of talking through, okay, where are we at? What do we need? And then when we get to a point where we need another staff, we work with them on getting that hired. And then, like I said, I kind of wanted to just share a success story
Oh, yes.
because it's actually been something that we're working on a discharge right now, which has been really exciting. We've had a young lady who started in CCS when she was around 14 years old and was just really struggling with a lot of mental health issues, a lot of family dynamics. She had a lot of youth justice involvement, a lot of aggressive behavior, and she kept having some police contact. Wasn't attending school, just kind of a lot of trauma, a lot of depression issues. And she worked with her CCS team really well. She had a therapist, a case manager, a mentor for a little while. The family really engaged in services and participated in family therapy and tried to make some changes at home to help her feel more supported. And she recently turned 18 and she's back in school. She's going to graduate this year and finish high school, which is awesome. She's playing basketball at school, which is great. And she's got a job. She's working almost full time and going to be very independent when she hits 18 and not need any services. And we're really excited about it.
All right, any other questions? Okay, thank you, Sarah. That was a very good report.
Chris, if I could just add something. What Sarah didn't, she was sort of alluding to, but as the youth treatment supervisor, Sarah oversees our children's long-term support and our youth comprehensive community services program. And we've been very fortunate since Sarah's been in this position because as you can perhaps ascertain, many of the children who are in our Children's Long-Term Support and CCS, are also involved with child welfare, also involved with youth justice. And so the collaboration and coordination between the two divisions and between all of those programs is very important to identify children who are in need of services and then get them into those services. And so, you know, I have been so impressed with Sarah and her team and what they have done. And you can see based on how the referrals are and the enrollments have been in the last 4 years, because the need is there, and we just want to make sure that, you know, people are getting enrolled into that program and into those services. So kudos to that team.
Very good. Thank you.
Love working with our other partners at the county and outside to, you know, provide comprehensive services as much as we can.
Okay, thank you again.
Oh, I'm sorry, I do have a question. Just like Christine asked before, are there any gaps or individuals, children you think that maybe you're not reaching, and maybe some strategies to capture them?
That's a great question. So I looked at our. I looked at our referrals over the past couple of years just to see, you know, how many are eligible versus not eligible. And so 2020 was kind of an off year, but we had 1 in 2020 and 1 in 2019 that we screened and were not eligible for services. And then what we do is connect them to what they could be eligible for, what they could access. So that might be outpatient counseling, that might be school-based. So we try not to just, you're not eligible, good luck. You know, we definitely support in making a referral and connecting to services that way. As far as like clients we're not getting, you know, that's a really good question. And I feel like based on our referral trend, we are really getting to the true CCS clients who are going to utilize and benefit from services, just with the trend that we've had. But I'm sure that there's always some out there that, you know, that we haven't heard from. We do sometimes run into, you know, we know a family or a kid will benefit from services and they don't engage, you know, they don't call us back. We try to reach them, we try to go out there and they don't show up. So I know that there are some that way that we know could benefit, but just aren't at a point where they can engage in treatment.
Yeah, just a concern of mine was you rely mostly on the schools, and just whatever, being a nurse is like, oh gosh, where's primary care in this?
Yeah, and that's you kind of like Tammy
Like,
said, I think
Lois
doctors' offices
pointed
are
that out.
hard to get to sometimes. You know, we've definitely done some outreach with some various community partners and gone to some resource fairs and things like that. We get a lot of referrals from hospitals. So like if a kid is hospitalized for mental health reasons or, you know, participates in treatment at Rogers or one of those systems, we get a lot of referrals that way. Sometimes we'll get a primary doctor who, you know, feels like a kid needs some psychiatric medication. And so we'll get a kid in that way. But that is probably an area where we don't get a ton of referrals, and it's been hard to do some outreach.
So parents can reach out to you and say, yeah, okay.
Yep, parents can make their own referrals, and they can, you know, that's a lot of what Kelly does throughout her day is, you know, talk to parents on the phone who have called or someone has said, hey, you want to check out this service? And she'll kind of talk through what it is and what could potentially benefit them.
Thank you.
Yeah, thanks.
Well, we didn't have any action items today, but there are reports like the ones that we've heard this afternoon, which reinforce the fact that as our committee members need to understand and know is that we are providing those services to the public. And that's what our main function is. So thank you for that. I think these reports are still good. Good to hear. All right. That takes care of our agenda. Our next meeting date is Wednesday, June 23rd. My birthday is the day after, so in case you want to make sure that you can bring the presents then.
I like chocolate.
So do I. All right, then. Thank you, everyone. We are adjourned.